everyone, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss transfusion, blood transfusion in newborns. Exchange blood transfusion. Here, EBT is done in severe case of jaundice. Here, we are going to see that EBT is very important in a jaundice case. And then here, exchange blood transfusion, a procedure. It is a procedure. The neonate blood that contains the higher bilirubin level is removed and fresh blood is administered. Main thing of exchange of blood transfusion is that here in the neonatal blood there will be the high bilirubin level, so we have to remove that one and have to transfer the fresh blood. This is the main motto of this one. Next, purpose of EBT, that is in case of severe hyperbilirubinemia or jaundice to prevent chronic teres. And then this is most effective and most reliable method for reduction of bilirubin level. This is the purpose here. Next, we'll see the indications of EBT. Here, cord blood hemoglobin level, that is 10 gram per dl or less. It indicates sign of hemolysis. And then cord blood bilirubin level 5 gram per dl or more. If this is the case, we need to indicate, we need to give EBT. And then conjugated serum bilirubin level, it has to be rising 0.5 mg per dl per hour despite phototherapy. And then serum bilirubin level greater than 20 mg per dl in neonatal period. And then acute bilirubin encephalopathy. And then last indication is when phototherapy fails to prevent the raise of bilirubin level. These are the indications of EBT. Next, blood to be used. That is, we had to blood to be used for this one EBT. First one is cross matched with both mother and baby here. And then fresh blood, that is less than 5 days old, preferred. And then third point is RH incompatibility, that is O negative, RH negative, and then cytomegalovirus negative blood. And then volume. Here, double the baby's blood volume, that is 160 to 180 ml per kg here. And then the normal amount of blood in neonate is 80 ml per kg. Next, we'll see the most important part of this, that is procedure of EBT. Here, we need to performed under aseptic conditions. Aseptic conditions has to be used, strictly. And then IV line is inserted and 3-way catheter has to be used. And then usually preferred by umbilical vein and artery here. And then small syringe of baby's blood withdrawn and push fresh blood with equal amount and rate. We need to use small syringe here to push the fresh blood. And then next, duration, that is repeat until recommended blood volume replaced. And then last point is procedure, that is continuous monitoring heart rate, respiratory rate, BP, and then SpO2 and temperature. This is all about the procedure of EBT, exchange blood transfusion. Next, we'll see the complications here. That is hyperolemia. Hyperolemia, it can cause cardiac failure in newborns and neonate. And then air embolism and thrombosis we can see, that is hypothermia. And then infection, that is hepatitis C, hepatitis B, and then HIV and malaria. These are the complications here. And then hyperkalemia and also hypocalcemia we can see. And then lactic acidosis. It may increase lactic acid in newborn, neonate blood. These are all the complications of exchange blood transfusion. Some more points I added here. 0.5 ml calcium gluconate injection should be administered after every 50 ml of transfusion to prevent hypocalcemia. Here, to prevent hypocalcemia, calcium gluconate injection should be administered, that is every 50 ml of transfusion. And then drug of choice for here for neonatal jaundice is phenobarbital. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.